Hi, I'm Barbara Kelly from the Hearing Loss Association of America. Hearing loss can be due to many different causes, some of which can be successfully treated with medicine or surgery, depending on the disease. Hearing loss can be conductive, from problems with the ear canal, eardrum, or middle ear with its little bones, the malleus, incus, and stapes. Types of conductive hearing loss include congenital absence of ear canal or failure of the ear canal to be open at birth, congenital absence, malformation, or dysfunction of the middle ear structures, all of which may possibly be surgically corrected. If these are not amenable to successful surgical correction, then the hearing alternatively may be improved with amplification with a surgically implanted bone-anchored hearing device, commonly referred to as the BAHA, or a conventional hearing aid, depending on the status of the hearing nerve. Other causes of conductive hearing loss are infection, tumors, middle ear fluid from infection, or eustachian tube dysfunction, foreign body, and trauma, as in a skull fracture. Acute infections are usually treated with antibiotic or antifungal medications. Chronic ear infections, chronic middle fluid, and tumors usually require surgery. If there is no response to initial medical therapy, infectious middle ear fluid is usually treated with antibiotics, while chronic, non-infectious middle ear fluid is treated with surgery or pressure equalizing tubes. Conductive hearing loss from head trauma is frequently amenable to surgical repair of the damaged middle ear structures. Otosclerosis, a genetic form of conductive hearing loss, there is bony fixation of the stapes, the third little bone of hearing in the middle ear. Sound can't get to the middle ear. Otosclerosis can be successfully managed with surgery to replace the immobile stapes with a mobile stapes prosthesis, or with a hearing aid. If hearing loss is due to problems of the inner ear, then it's classified as sensorineural hearing loss. Sensorineural hearing loss can result from acoustic trauma or exposure to excessively loud noise, which may respond to medical therapy with corticosteroids to reduce cochlea hair cell swelling and inflammation to improve healing of these injured inner ear structures. Sensorineural hearing loss can occur from head trauma or abrupt changes in air pressure, such as in airplane descent, which can cause inner ear fluid compartment rupture or leakage, which can be toxic to the inner ear. There has been variable success with emergency surgery when this happens. Sudden sensorineural hearing loss, presumed to be of viral origin, is an otologic emergency that is medically treated with corticosteroids. Bilateral progressive hearing loss over several months, also diagnosed as autoimmune inner ear disease, is managed medically with long-term corticosteroids and sometimes with drug therapy. Autoimmune inner ear disease is when the body's immune system misdirects its defenses against the inner ear structures to cause damage in this part of the body. Fluctuating sensorineural hearing loss may be from unknown causes or associated with Meniere's disease. Symptoms of Meniere's disease are hearing loss, tinnitus, or ringing in the ears, and vertigo. Meniere's disease may be treated medically with a low-sodium diet, diuretics, and corticosteroids. If the vertigo is not medically controlled, then various surgical procedures are used to eliminate the vertigo. Sensorineural hearing loss from tumors of the balance nerve adjacent to the hearing nerve generally are not reversed with surgical removal or irradiation of these benign tumors. If the hearing loss is mild and the tumors are very small, hearing may be saved in 50% of those undergoing hearing preservation surgery for tumor removal. Sensorineural hearing loss from disease in the central nervous system may respond to medical management for the specific disease affecting the nervous system. For example, hearing loss secondary to multiple sclerosis may be reversed with treatment for multiple sclerosis. Irreversible sensorineural hearing loss, not manageable with medical treatment or with hearing aids, can be surgically treated with cochlear implants. So these are the options available if your hearing loss can be treated medically or surgically.